His hands were shaking more than mine, which, considering I was the one holding the needle, was saying something. The fluorescent lights hummed above the hallway, casting a sterile glow that made the linoleum smell faintly of disinfectant and old coffee. I could hear the distant murmur of monitors, the occasional sigh of a tired resident, and the soft, almost reluctant rustle of a blanket being pulled tighter around a patient's shoulders. He was a 29-year-old traveler, his passport still tucked in his jacket pocket, the ink still glossy from the last stamp. He'd come in for a routine tetanus booster after a hiking mishap, but his nerves had turned the simple visit into a drama. He glanced at the empty chair across from me, then back at the vial, his eyes flickering like a candle in a draft. Is it going to hurt?" he asked, voice a little higher than he intended. I could hear the tremor in his question before the words even left his throat. I smiled, letting my voice settle into a warm, unhurried cadence. "Only as much as you let it," I said, letting a hint of humor slip through. "Think of it as a tiny pinch of destiny, and I'll make sure it's a gentle one." He chuckled, a nervous little sound that made the room feel a fraction smaller. I slipped on a pair of latex gloves, the thin material stretching over my fingers like a second skin. The scent of the gloves, somewhere between rubber and a faint citrus, joined the chorus of hospital aromas, an oddly comforting perfume that always reminded me of first-day nerves and fresh starts. Finding the vein was a ritual I'd performed countless times, yet each encounter still felt intimate in its own quiet way. I asked him to relax his arm, to let his shoulders fall away from his ears. He obeyed, his fingers unclenching, the muscles in his forearm softening like a well-worn rope. I ran my thumb along the skin, feeling the subtle rise of the basilic vein, its bluish trail just beneath the surface. The skin was warm, a reminder that he was alive, that his blood was flowing, that the world was still turning beneath his skin. "Okay," I whispered, my tone conspiratorial. "I'm going to use a 20-gauge needle, small enough that you'll barely notice it, but sturdy enough to get the job done." I pressed the vial against the light, the amber liquid catching the glow and turning it amber gold, like sunrise in a bottle. I cleaned the site with an alcohol swab, the cool sting of the antiseptic making a tiny, brief shiver across his skin. The scent of the alcohol was sharp, a reminder of the many moments where I'd had to balance precision with compassion. I let the swab dry for a breath, giving him a moment to settle his breathing. "Take a deep breath in," I guided, "and let it out slowly." He inhaled, his chest rising, then exhaled, the tension in his hand easing a fraction. The rhythm of his breathing matched the slow, deliberate pace I liked to keep when I worked. Nothing rushed, nothing hurried. I positioned the needle at a 15-degree angle, the bevel up, and gently slipped it into the vein. The puncture was barely there, a whisper of a prick that disappeared into the soft tissue. He flinched, but only for an instant, and then relaxed, his eyes meeting mine for a heartbeat longer than usual. In that moment, I felt the quiet exchange of trust, the unspoken agreement that I was there to help, to heal, to hold the line between fear and relief. The syringe filled with the vaccine, a smooth amber flow that seemed to settle into his bloodstream with the soft sigh of a promise. I pressed a small piece of gauze over the site, a gentle pressure that felt like a comforting hand on a bruised shoulder. "All done," I said, my voice low enough that it felt like a secret shared between us. He let out a breath he didn't know he'd been holding. "Thank you," he murmured, and there was a soft, grateful smile tugging at his lips. I could see the faint lines around his eyes, the way his shoulders dropped a little, as if the weight of his anxiety had been a little lighter. While I was still there, I took the chance to add a little extra care. You know, after a vaccine like this, it's normal to feel a little sore at the injection site, I explained. But if you notice any swelling or a fever that climbs above 132 degrees Fahrenheit, you might want to take an over-the-counter pain reliever like ibuprofen. Keep the arm elevated, and a cool compress can help the soreness go down faster. I could see him nod, his mind already cataloging the advice like a traveler noting landmarks on a map. He asked about the fever tip, a little chuckle slipping through his voice. "I'm not exactly a medical student, but I think I can manage that," he said, his tone lightening. I laughed, the sound echoing softly off the walls. If you ever feel uncertain, give your primary care doctor a call. It's always better to be safe than to wonder if you've missed something. We lingered a moment longer, the clock ticking softly in the background, each second stretching into a quiet intimacy that felt more like a shared secret than a professional exchange. His eyes, now clearer, flicked to the door as if he were ready to step back into the world outside the hospital's hum. I walked him to the exit, the hallway lights guiding us like a gentle tide. "Take care," I said, my voice a soft sigh. "And if you ever need another pinch of destiny, you know where to find me." He turned, gave me a look that lingered a beat too long, and then slipped out, his steps steadier than when he'd entered. I watched the door close, the soft click a reminder that each patient carries their own story, a tapestry of nerves and hopes and the smallest moments of trust. As I turned back toward the nurse's station, the scent of antiseptic still clung to the air, and I felt the lingering warmth of the encounter settle in my own skin. The night shift would go on, the corridors would keep humming, and I would keep holding needles, each one a quiet promise of care. And somewhere, perhaps, a traveler would remember that brief, gentle touch and smile, even when the world outside felt far too big.